Yeah, look, and certainly there are a few different types of migraines, and what we look at are the ones where light flicker or light or brightness of light can be one of the triggers for a migraine. And the other side of it is that once you actually get a migraine, a lot of people become very light sensitive. So one of the common sort of things you hear about when someone's having a migraine is that they need to go and find a dark room to hide themselves away in while it sort of passes, because the light sensitivity they get during a migraine attack is almost debilitating, in many
Mm.
cases. And there's been some tints around for a long time. The FL-41 is probably the one that a lot of people sort of know about as a classic migraine assistance. And look, none of these are cures. The idea is that we're just trying to improve quality of life around migraine. More recently, there's been one where Avulux is a specific type of tint that was specifically targeted and researched to look into light sensitivity with and without migraine. And they discovered that there are frequencies, light frequencies or wavelengths on either end of the spectrum that are pain inducing. So there's some in the blue and there's
Mm.
some in the amber. And they also found that there are green wavelengths that actually reduce pain. And so they combined that together in a tint. And what they basically look at, it falls into two categories of uses. You get the people who know a migraine is coming and start wearing the tint in order to make sure that the migraine that follows is not as severe, so they can get on with the day, they can still be productive, they don't have to kind of lose a day or more to recovering from a migraine. And then you get people who maybe know what certain light situations may trigger their migraines. They may use the Nabulux tint in those kind of situations to try and avoid the migraine being triggered to begin with. And certainly people who get migraines very frequently, 2 or 3 times a week, might choose to wear a tint if they find it useful to reduce the number of migraines and the severity that they get.
Mm.
And the challenging part of it is that this is something that we need to trial. Not everyone responds, but that's why we set up a trial sort of situation for the right patient who presents with migraine. We obviously also want to, so anyone who's got a new migraine needs to have a full health and vision check done just to ensure that it is a migraine and not symptoms of something that could be a bit more serious. But once it's that we're medically satisfied that it is migraine, then and there is an element of light sensitivity in leading up to it or during, then the Avulux makes a tool that some people find beneficial in managing their symptoms.
And those are actually lenses. They're available as prescription lenses as well, aren't they?
Both, yeah, yeah.
Yeah.
So if we do a trial and we find someone, they find that the Avulux improves their symptoms, then they can get it as a fit over, so that when an attack's coming, or if there's a particular situation where they know that tint is beneficial, then they can get a frame. This is not a fit over, but it's like the old fit over sunglasses that go over the top of
Mm.
your glasses. So it
Mm.
gives you some flexibility of having your prescription glasses on and then just applying the tint as you need it. For those people who like to work in their Avulux tint or find that they're wearing it a lot of the time, and so then we can make them up as an actual prescription with the tint
Right.
in there. And
Right.
there is an Australian lab that has the distribution license and rights to make the Avulux tints in Australia.
Okay. So you can put those lenses into somebody's existing frames if that's what they want then.
Yeah, yeah. So it's a whole new lens. It's not a tint that we can apply to existing
Mm.
lenses. They have to make the lenses from scratch.
Okay. So when would you suggest like Avulux versus the FL-41 lenses? Like how would you make that decision about who's, best suited for each of those types?
Yeah, look at and that's the tricky part sometimes with color. Sometimes, someone may even benefit just from a simple gray lens, just reducing the overall amount of light that they're dealing
Mm.
with.
Mm.
Whereas others have to be, some people are very specific it appears in the color of the tint that actually makes them more comfortable. And we can talk about it a bit more when we get into sort of pack and glare um,
Mm.
later on. And I have probably more experience with the Avulux because it looked a little bit more comprehensive in what wavelengths it was dealing with.
Mm.
And it's probably just from a, wearability point of view, it's a more neutral looking sort of tint. It's not quite so
Mm.
obvious.
Mm.
And we always sort of So we do a questionnaire on when someone gets their light sensitivity, how it sort of operates, and then if they look suitable, then we offer the trial. Certainly, we can do some sort of chair side assessments because you get some people who are sensitive, and you put them on, and they may immediately dislike that color personally, and
Mm,
that's what we might look at, or maybe an FL-41 tint of some sort might be more suitable.
mm. So it's the FL-41s are the rose tinted ones,
Yes,
aren't they?
that
Yeah.
rose color, yeah,
Literally,
yeah,
literally looking at the world through rose-colored
rose colored
glasses.
glass. That's right.
So would like are one of those types better for outdoor use than the other, or is it sort of like much and muchness really?
Much for muchness. I mean, I tend to think that the tint color in the Avulux is a little bit more natural. So it can be worn outside. Some people who find a tint beneficial still want something a little bit darker. So they might move
Yeah.
to a traditional pair of dark sunglasses in that time. Again, some people don't like sensitive to even polarizing. So this is some of the things you've got to kind of
Yeah.
find your way through. Yeah.